Congenital heart defects, atrioventricular septal defect. By Jennifer Hanna for Structure and Function of the Human Body. According to the Centers for Disease Control, CDC, congenital heart defects, CHDs, are the most common form of birth defects. 1 in every 100 babies is born with a congenital heart defect. 1 in every 4 of those 100 are born with a critical CHD, meaning they will need surgery within the first few weeks of birth. Atrioventricular septal defects, AVSD, account for about 5% of all CHDs. There are 2 forms of AVSDs, partial and complete. A complete AVSD affects the septum, dividing the right side from the left, as well as the valves, dividing the atria from the ventricles. A partial VSD is similar to complete AVSD, but does not have all the same defects. A heart with partial AVSD typically has 2 separate valves, whereas one with complete AVSD has 1 common valve. This picture shows you the difference between a partial and a complete AVSD. The picture on the left is a partial AVSD. You can see that there are still 2 valves, but the septum is missing at the top. In the picture on the right of the complete AVSD, you can see that there is no septum and that there is 1 common valve. A normal heart has 4 chambers, 2 atria and 2 ventricles separated by a septum. It has a mitral and tricuspid valve that allow blood to flow into the ventricles but prevent it from flowing backwards into the atria. Right side pumps blood to the lungs and the left side pumps blood to the body. In this picture you can see a normal heart and its circulation. The blue deoxygenated blood comes into the right atrium via the SVC and the IVC, flows into the right ventricle, and out the pulmonary artery to the lungs to be oxygenated. The red blood, oxygenated blood, then comes in from the lungs to the left atrium, flows down into the left ventricle, and out the aorta to the body. A heart with an AVSD typically only has 2 chambers, a top and bottom, 1 common valve allowing backflow of blood, and large holes between the atria and the ventricles, which causes mixing of oxygenated and deoxygenated blood. This causes low oxygen levels and also causes extra blood to flow to the lungs, making them work harder, which in turn makes the heart work harder. The extra work on the heart can cause congestive heart failure, CHF. When this occurs, fluid builds up around the heart, causing it to not pump as well. Blood moves more slowly through the heart and the body, and the heart can't pump enough oxygen and nutrients to meet the body's demands. Here's just another picture showing an atrioventricular septal defect. There's no septum between the atria and the ventricles, and there's also 1 common valve there. And here's another picture of a normal heart versus a heart with an atrioventricular septal defect. You can see in the heart with the AVSD on the right how all the blood just kind of mixes together and flows wherever. Other anomalies of the heart can be present with an AVSD, affecting other functions of the heart. CHDs can affect other organs and functions of the body. Developmental delays are common due to prolonged hospital stays and surgeries. Many children need therapies because of this, physical, occupational, and/or speech therapy. Some of the necessary medications to manage the defect can cause organ failure, most commonly the kidneys. The exact cause of AVSD and CHDs is unknown. There's possibly a hereditary component, but there is not enough research to prove that. CHDs can be very common in several genetic disorders, such as Turner syndrome, DiGeorge syndrome, and Down syndrome. And AVSD in particular is seen in 80% of infants born with Down syndrome. Smoking during pregnancy has been linked to septal defects. And a mother's diet, medications she may take during pregnancy, and the environment are all thought to be components of CHD causes. Some of the signs and symptoms of a complete AVSD include disinterest in feeding and poor weight gain, fatigue, diaphoresis, just sweating to an unusual degree, pale or cool skin, tachypnea, tachycardia, and cyanosis. Symptoms are the same with partial AVSD, but typically do not present until later in childhood or adolescence. Some of the short-term effects are cyanosis, poor weight gain, and fatigue. These will typically resolve after surgery to repair the defect is completed. Patients with AVSD are at risk for arrhythmias, blood clots, infections, leaky heart valves, heart failure, and stroke. Repeat surgery may be needed for residual mitral valve regurgitation. Antibiotics may be required for dental appointments to prevent endocarditis, which is an infection of the inner lining of the heart involving the heart valves. If heart failure develops, a transplant may be necessary. Patients with AVSD will require lifelong care from a cardiologist. These effects are continually improving as better surgical techniques and interventions are discovered. Diagnosis of an AVSD can be done through routine ultrasound or a level 2 ultrasound in utero. Pulse oximetry testing shortly after birth. An oximeter is placed on the infant's right hand and right foot to check oxygen levels in the blood. It requires a reading of 95% or higher to pass. An electrocardiogram, EKG, an echocardiogram, echo, chest x-ray, and cardiac catheterization can all be used to diagnose an AVSD. Some of the testing devices, pulse oximeter measures the amount of O2 in the blood, an echocardiogram, which is the most common testing device used to diagnose an AVSD. Completing an ultrasound of the heart can identify structural problems and irregular blood flow. An EKG measures electrical activity of the heart and will show arrhythmias. Surgery is required to repair the defect. Holes in the septum are closed with patches. For a partial AVSD, the mitral valve must be repaired or replaced. For a complete AVSD, separation of the single valve into 2 valves is required. In some cases, this repair cannot be completed, and other surgical interventions may be performed in separate stages. Here's a picture of the repair of a complete AVSD. You can see the patches that were placed to repair the septum, and 2 valves are created out of the single valve. Conclusion: infants that have surgery are not cured and may face lifelong complications such as a leaky mitral valve. There are always new ways to diagnose CHDs, as well as improved interventions and surgical techniques are always being developed. With proper treatment and follow-up care, most babies with AVSD will grow up to lead a relatively healthy and productive life. Here are my 2 pages of references. And that is all I have for you. Thank you.